Tonight,
They called us in and said, hey, you have breast cancer.
He was like really sick. He scared me because I've never seen him that sick.
an ABC 27 special presentation.
To hear them say breast cancer for him, I was shocked, I was upset, and I cried.
I'm moving on with life. I'm not going to let it hold me back.
Hope and Courage, a tribute to breast health, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. October is dedicated to breast cancer awareness. It's the time of year when women and men wear pink and are proud to do so. The latest statistics show 1 in 8 women in the United States will develop breast cancer. It is the most common cancer in women in the U.S. Men can develop it too. This year, more than 2,500 men will be diagnosed with the disease. And tonight, you'll meet a Dauphin County man who is part of that statistic. What is the best way to diagnose breast cancer? What are the symptoms like for a man? And what are the latest treatment options? You will find out tonight. And if you have questions at home, Christina Butler is here to tell you how to get them answered. Hi, Christina.
Hi, Deborah. Specialists from Penn State Health are in the ABC 27 call center right now. They're ready to answer your calls and answer your questions. You can call the number on the screen until 8 o'clock, or you can email your questions during tonight's show to questions@abc27.com. Dr. Melody Polishak will answer your emails throughout tonight's show. All calls and emails are confidential, and I'll be back later in the show to share some of those questions with you. Back to you.
Thanks, Christina. When we talk about breast cancer, we think of women, but men get the disease too. It's rare. Less than 1% of breast cancer cases are men. We just learned that Beyonce's father was diagnosed with breast cancer. Well, a Dauphin County man found out that he was part of that statistic too. Here's Wade Shear's journey.
Altogether, between the coat, the helmet, air pack, and all that, it's well over 100 pounds that we'll wear going into a fire.
Wade Shear knows this equipment like the back of his hand. He's been a firefighter for more than 30 years.
So we have our CPR masks. Always carry 2, just never know. One doesn't work or something's wrong with it.
And nearly that same amount of time as an EMT. His memories are a constant reminder of why he does it.
I was working Chambers Hill ambulance, and we got dispatched to the intersection of 322 and Chambers Hill Road for a childbirth. We get them all the time. Mom's not near ready to give birth yet. And as we were pulling up, the police officer yelled, "Get up here." I start to see the head, and we're like, oh, this is real. And we delivered the baby right in the middle of the intersection. And we delivered a healthy baby girl right there.
Wade is always thinking of others, even during his darkest hours. Over the past year, he's had some.
I was driving my truck and I noticed that my seatbelt was causing a little discomfort in my breast. I didn't think anything of it, thought it was like, just pressure.
And then the one night he come home, I'm like, honey, your nipple's inverted. And he's like, I didn't notice.
She's like, you need to go to the doctor. I'm like, I put it off a little bit, and then I said, all right, I'll go, because it was starting to hurt.
Wade's physician directed him to Penn State Health Breast Center.
They did a mammogram, and they did an ultrasound, and they're like, right then and there, we're going to biopsy it. There's something there, we need to biopsy it.
And he calls me back and he goes, they want me to do a biopsy today. And I'm like, okay, do you need me to come from work? He goes, no, I'll be okay. And I'm like, all right.
Like a week later, they called us in and said, hey, you have breast cancer. This is the results, this is what it is.
He had a fairly small cancer. It was located not far away from the nipple. We did a further workup and actually found some suspicious what we call adenopathy, or enlarged lymph nodes under the arm, and a biopsy of those showed that he had cancer in the lymph node as well as having cancer in the breast.
To hear them say breast cancer for him, I was shocked. I was shocked, I was upset, and I cried.
Me, just being me, I'm like, all right, what do we got to do? Let's hit it on.
So he started with his chemotherapy treatment. The subtype of breast cancer that Wade had was HER2 amplified breast cancer, estrogen positive breast cancer. It always requires chemotherapy, and it requires chemotherapy with targeted therapy. So what targeted therapy means is it's something combined with the chemotherapy to make the chemotherapy even more effective.
We were going to have the chemo. We were going to do 6 rounds 1 round every 3 weeks, and we did, and that was rough. That was very rough.
He was like really sick. He scared me because I've never seen him that sick. I mean, he's a man of movement, and if he's not moving, there's definitely something wrong. So it was scary.
During the roughest times, there was hope.
I think it was the 3rd round, my nipple came back out. And I noticed it, and she noticed it. Well, I'm like, So I sent a picture to Dr. Dodds, and she's like, that's awesome. That's what the tumor shrunk 3/4 its size from the chemo. I'm like, all right, sweet, I'm done with chemo. Let's do surgery, let's get it out of my body, you know.
So one of the advantages of giving the chemotherapy first for Wade was that we were able to not only see how his tumor responded, but that response allowed us to keep his nipple. Because the tumor shrank, I was able to get negative margins when I did his partial mastectomy and leave him with a much better cosmetic result.
After his surgery, what happened is the tumor was examined closely by pathologists to detect what residual cancer was left following the 6 cycles of targeted therapy and chemotherapy. And then based on that, we were able to decide the next parts of his treatment, which in Wade's case involved radiation and also more targeted systemic therapy.
Wade went through a month of radiation, and he just finished 6 months of targeted systemic therapy, almost a year after he was diagnosed.
He's been a true champion. To see him at his worst and then to see him now, he's a big change. Big man, big change. So I'm happy that we've made it through this.
I'm moving on with life. I'm not gonna let it hold me back because I had cancer. You know, I'm gonna say I beat it, and I moved on.
He's a fighter, and he wants to help other people fight, so it's good.
A year that has changed Wade's life, and now he hopes to change others.
I'm gonna try to use myself like an example, kinda, you know, for other people to see that, yeah, it kicks you, it knocks you down, but you can get back up, and when you get back up, you're stronger. Because you have that little badge of courage that, you know, inside you that says, you know, I beat that.
Wade says he took this really big negative and turned it into a big positive. He really hopes to help others who are going through this same thing. Now joining us is Dr. Dalila Dodds, Wade's surgeon. He's such a great guy.
He is. He's amazing.
In the past 11 years that we've been doing the show, this is the first time that we have featured a male breast cancer patient. So it is rare.
Well, it is. Only about 2,700 cases a year in the United States, but it's 2,700. And it's a little more common in men that are of African American descent, and we have to be aware of it, and we have to know how to treat it. So we thought it was an important thing to bring forth in this program.
Now, since men don't typically get mammograms like women do, how do they detect breast cancer?
Well, we have a term called breast awareness, and women are supposed to be breast aware as well. So there are signs and symptoms. There's the mass, the palpable thing that we feel, but there are also other subtle things, pulling on the skin, a change in the direction of the nipple, a discharge from the nipple, or some area of rash or redness that doesn't go away. All those things can be signs of breast cancer, and they warrant evaluation.
And pretty much the same signs that a woman would have.
Absolutely, absolutely.
Now, in Wade's case, he had both chemotherapy and radiation. Why in some cases do you need both, and in some cases you don't?
So some tumors require chemotherapy because they're already aggressive enough and because they're sensitive to it. And chemotherapy, it treats the entire body. It catches any cells that may have escaped from the tumor. So when our lymph nodes already have cancer and so on, often we need that type of therapy to do well. We may also need pills as well, and that works systemically. Radiation only works where we give it. So it helps prevent the cancer from coming back where it occurred in the breast,
but it doesn't affect that systemic recurrence, that chance of metastases.
Really good explanation of the difference between the two. Dr. Dodds, we will talk to you a little bit later in the show, but if you would like to make an appointment at Penn State Health Breast Center, call 866-204-8414. Let's check in with Christina Butler in the ABC 27 call center. How are the calls going there, Christina?
Hi again, Deborah. The calls are coming in, and a reminder that you can call in until 8 o'clock tonight. The number is 717-346-3333. Here to answer our viewer questions tonight, Nicole Cook, breast imaging navigator. Thanks for joining us. Let's jump right into our first question. I was just recently diagnosed with breast cancer. The amount of information I'm receiving is overwhelming. How do you help your patients keep everything straight?
I always tell them, to bring somebody with them to their appointments, to have a second set of ears. And it's always good to have a journal, keep it by your bed, write down questions. They come to you at night when you're sleeping sometimes, so it's good to, do things like that. And then, you can always rely on your nurse navigator. If you are stuck with something that you don't understand, you can call her, and they're usually keeping tabs on everything, so.
They'll walk you right through it, okay? Thanks, we'll be back with you in just a bit. If you have a question and you can't get through on the phones, you can email your questions to questions@abc27.com. Stay with us, we'll be right back.
You're watching Hope and Courage, a tribute to breast health on ABC 27, sponsored by Penn State Health.
Welcome back. A Lebanon County woman was looking forward to her summer break from teaching. Kelly Frew never got the break she was expecting. Here's Kelly's journey.
The last one's okay.
Kelly Frew starts her 21st year teaching at Milton Hershey School.
The kids are wonderful. They're just so welcoming, and they really make you feel good about being a teacher there. And the staff that you work with are amazing, and they're all there for the same mission, and you're all driven to make a difference in the lives of these kids.
Kelly is already knee-deep in schoolwork.
I teach pre-calc trig to mostly 11th and 12th grade students, and then I have an Algebra 2 class that I teach to mostly 11th grade students.
It's truly amazing that Kelly is back in the classroom. While the kids had the summer off, she had to study a topic that was unfamiliar to her: cancer.
I think it was the last week of April, I had my first mammogram, and both my mom and the staff had talked to me about the fact when you have a first mammogram, you're probably going to get called back because they don't have a baseline or anything to compare it to.
As Kelly expected, she got a call back for more images and an ultrasound. What she wasn't expecting is what they said.
They said we would like to biopsy some of the areas just to see what's going on. And so then that was the first time when I got a little bit nervous.
After the biopsy, Kelly and Mark found out the results.
They told us that it was in fact cancer, and news that they really didn't want to, to deliver.
The diagnosis came back as ductal carcinoma in situ with microinvasion. Ductal carcinoma in situ means where we have these abnormal cancer cells that are still inside the duct. And hers were called high grade, so meaning they're very abnormal looking. She also had small areas of what are called microinvasion. It's where those cancer cells are just starting to break through the lining of the duct.
Even though they kept trying to reassure us that it was early and it's treatable and stuff, but anytime anybody uses the word cancer, it's a really scary thought.
You walk out with a book about breast cancer, and you walk out with a binder about cancer in general, and it was overwhelming.
We also recommended that she be seen by a genetic counselor due to the fact that she was only 42 at time of diagnosis.
Your genetic testing results can really be telling of how you're going to treat, the breast cancer and what you're going to do moving forward.
She ended up being found to have a BRCA2 mutation, which elevates her risk of developing a second cancer in the future.
They were very reassuring that this is treatable, we can be aggressive, we can get it quickly, and she can have a healthy, normal life.
That really prompted me to make the decision of the choice of treatment that I did. So because of the BRCA2 and the breast cancer gene, I chose to, or elected to have a bilateral mastectomy.
For all my patients that are considering mastectomy, I strongly encourage them to see plastic surgery. It doesn't mean they have to have reconstruction, but I think they should weigh their options, the pros and the cons.
I like to spend a lot of time doing education, talking about the different options for breast reconstruction, and then finding out from the patient what truly is important to them in terms of recovery and expectations for appearance.
Thinking about reconstruction, they talked about, and a lot of research has shown that it's just a little easier to do it right away. So I opted and elected to do that.
What we performed was bilateral mastectomies, and we called it skin sparing, meaning we left as much of the skin as we needed or could to allow Dr. Henry to have all the skin she needs for reconstruction.
In most patients, you end up having to do a staged reconstruction where you start with a tissue expansion of some kind. We started with a fairly minimal volume in the tissue expanders, and then she was allowed to heal for several weeks after surgery. And she was also feeling a lot better from a pain and a energy standpoint. We started the expansions in the office.
Some final steps to complete this journey, just in time for the start of school.
I had to be back at school on August 13th, so almost 5 weeks after surgery. I was ready to go. I felt good, and so I wanted to get in there, and it was okay.
She's doing great, absolutely. She is 100% active and involved in everything she was pre-surgery and pre-cancer.
The start of the school year is off and running, and we're in the midst of it, and I feel good, and I've come out on the other side of it.
Kelly spent only one night in the hospital. She said the recovery process went a lot smoother than she thought it would. Joining us now is Dr. Christine Witters, co-director of Penn State Health Breast Center and also Kelly's surgeon. Talk to about coordination of care. How does it work there at the breast center?
One thing that's really unique to our breast center, I think, is that everyone is housed in the same location. We have breast surgery, radiology, radiation oncology, plastic surgery, as well as our genetic counselors. This allows us as providers to easily communicate and allows an ease for patients as they navigate the system.
Oh, I'm sorry.
I was going to say we also have great nurse navigators. We have Sarah and Nicole, who work at our Penn State Hershey Breast Center. We also have Joni, who's at our new Lime Spring location.
Now, most of the patients that we saw tonight, or we're seeing tonight, are young in age. So does that mean we're detecting it earlier, sooner, or are there more cases?
The National Institute of Health released recent data from 2012 to 2016, and about 30% of new cancer diagnoses were in women younger than age 54. Also, the American Cancer Society had some recent data, and they are seeing a slight increase in trend in women younger than 40 getting breast cancer. I also think it's partly that women in this age group are surviving more and more, so we're hearing more about it. We still recommend that women over 40 get an annual mammogram. We also recommend that women really talk to their providers about their breast cancer risk.
Kelly had indicated that it was difficult to tell her children that she had breast cancer. How do you deal with that as far as helping them through that process?
Cancer is never something easy to hear as a patient, nor easy to say to your family. Cancer, I also believe, is not something that should be fought alone. I cannot say thank you enough to the countless family, friends, and community organizations that support our patients. We also have an amazing staff that walks patients through their medical treatment. We have 2 nurse navigators that do a great job with support groups. They also lead CLIMB, a program for children of patients with metastatic disease. And we had a psychiatrist last year who led a couples retreat for some of our breast cancer patients.
Okay, lots of good information. Thank you, Dr. Witters. And if you would like to make an appointment at Penn State Health Breast Center, call 866-204-8414. And let's go back to the ABC 27 call center. Christina.
Hi again, Deborah. We're back with Nicole Cook. We want to go right to our next viewer question. This person says, is Penn State Health planning any screenings or events for Breast Cancer Month?
The answer to that is yes. We have extended our hours into several evenings in October so that, we can fit everybody in. Also, I just want to mention, and you can see the times on the screen, right? Okay, and I also want to mention we just had a caller who asked if you can have a screening mammogram if you have breast implants, and the answer to that is yes. You can, so everyone can come and get screened.
Okay, thanks for letting us know about that call. That's good information, and we do have the information on our screen right there. To register for either location, Hershey, or Lime Springs, you can call 1-800-243-1455. Nicole, thank you for your time, for answering our viewer questions tonight. Thanks to all of the providers here answering questions. Deborah, back to you.
Thanks, Christina. A Lancaster County woman never expected to get a mammogram when she was 33 years old. It's a day she'll never forget. Here's Angie Ziegler's journey. Angie Ziegler and her boyfriend Kevin Rosado have dated for more than 4 years. They have plans for a future together, a future that includes starting a family. But those plans were put on hold.
April comes around and I found a lump. It was located in my left breast, very close to the nipple. It was hard.
So at Penn State Health Lime Spring office, Angie had a mammogram, an ultrasound, a biopsy, and an MRI. Images that revealed much more than what they were expecting.
You can see the cancer that she felt in the left breast, but look here in the right breast. This is the cancer that we had no idea was there based on the mammography. And then as you scroll further up through this, and you find this other area of cancer right here, also in the left breast. So she had bilateral cancer.
Came home with a book, and we were looking at books and pictures and all this stuff detailing what kind of cancer she has and so on and so forth.
I was very like, okay, let's get it done. Let's be active, let's do it. Just whatever we need to do, let's do it.
We spoke in depth about considering mastectomy as opposed to breast-conserving surgery, but Angie very much wanted to keep her breasts if she could do so safely without compromising her risk of survival.
Angie chose to have a partial mastectomy. A week before the surgery, doctors placed markers on the tumor sites.
In Angie's case, 2 of these were smaller and weren't something that I could feel. So we placed what's called a Savvy Scout. We now have a new radar clip that we can put in, that I have a little device in the operating room that tells me exactly where that clip is. So I put this probe right over the area and I know exactly where the tumor is.
The latest in technology that made a difference in Angie's surgery.
What we're doing in a partial mastectomy is we're taking the cancer and some surrounding tissue. In this case, we're taking additional surrounding tissue, similar to what they do in a breast reduction surgery, cosmetically, to allow us to move the tissue in a way where the patient's breast contour ends up being the most aesthetically pleasing, and in her case, symmetric.
It was Dodds who came down and said, we got all the cancerous tumors, we got the nodes out, we're gonna check them. As far as the eye can see, she's clear for now. And that was a little overwhelming. It's great news. I think me and her mom kind of fell apart there for a minute, but it was all happy tears.
Several weeks after the surgery, Angie and Kevin soon realized their fight wasn't over.
We tested the tumor for Oncotype, which is a 21 gene assay that tells us whether this cancer is likely to recur or less likely to recur. It showed that her cancer was actually much more aggressive than what we would have expected just looking at the markers that we had to that point. She had an Oncotype of 27, which put her in the range where, in addition to taking the anti-estrogen pill, we've recommended chemotherapy.
But I'll be fine. I'm very positive about it. I have a great support team. Hair, I'm not so worried about. It'll come back. It's that sickness. I don't want to be sick.
Not the news we wanted, but it's the news we got. So we're gonna do the chemo and kick its butt.
Before the treatment started, doctors made sure Angie's dream of a family could come true.
So right now, I'm going through fertility treatments in order to preserve embryos.
Unfortunately, the treatments that we give, both the anti-estrogen and the chemotherapy, can induce early menopause and rob a woman of her opportunity to have children. So what we can do is we can give patients medicines that stimulate hyperovulation, and then harvest those eggs and then preserve them, freeze them for the future to allow them to have children, and that's what she had done.
I just want one child, one, you know, if I'm blessed with more, but just one.
It was important to me to keep Angie's hopes and dreams alive, to eventually have a baby and have our own little family.
Angie went through her fertility treatments and now is on chemotherapy. Joining us again is Dr. Dodds. So having a family was really important for Angie. What do you do as far as fertility for patients?
I think the most important thing is that any woman that's in childbearing years, we can't forget while we're treating their cancer to ask them whether they still want to have children and to make sure that we step back and get them to a fertility expert if they do.
And Angie received most of her care at the new Penn State Health Lime Spring location. It's a beautiful facility. Tell us what is offered there.
All of diagnostic mammography is there, so we can do any kind of imaging. We have breast MRI there as well. Biopsies are done there. Surgeons are seeing consults for benign and malignant breast disease. We have a high-risk assessment there and clinic, and we're also now going to be offering genetics.
Okay, thank you so much for all the information tonight, Dr. Dodds.
Absolutely.
And we also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information or if you would like to schedule an appointment with Penn State Health Breast Center, call 866-204-8414 or visit online at hmc.pennstatehealth.org. We want to thank you for watching tonight, and we wish you good health.